Hello, I'm Dr. Cheryl Viracola, Director of Practice Advancement for the North Carolina Association of Pharmacists. And I'd like to welcome you to this video segment where we will discuss syringe access and how to make pharmacy part of the solution and not the problem. Since the onset of the COVID-19 pandemic, the national overdose deaths at the end of 2020 exceeded 93,000 cases, resulting in an alarming 32% increase from 2019. In fact, 2020 marked the worst year ever reported for opiate-related overdose deaths since the start of the opioid crisis in the early 90s. North Carolina follows similar trends, with 2021 provisional data suggesting a 29% increase in suspected overdose deaths. And if that doesn't resonate, then I would ask you to consider this, that based on this data, we now have more than 9 North Carolinians losing their lives every day to a drug overdose. Furthermore, illicit opiates like heroin and fentanyl are now driving most of the overdose deaths in North Carolina. With the increased use of heroin and fentanyl, injection drug use has soared, leading to the transmission of blood-borne infections like hepatitis C, HIV, and endocarditis. According to the CDC, rates of hepatitis C actually quadrupled between 2009 and 2019, especially in those 20 to 39 years of age. Annual hospitalizations in North Carolina for drug use-associated infective endocarditis also surged, an overwhelming 12-fold between 2007 and 2017. Pharmacists can play a critical role in reducing disease burden caused by injection drug use simply by promoting the non-discriminatory sale of syringes. In other words, choosing to sell syringes regardless of their intended use and with no questions asked. In North Carolina, there are no laws that prohibit pharmacists from selling syringes without a prescription. There are no age restrictions, there is no need for identification, or even limits to the number of syringes pharmacists can sell at any given time. Yet despite these facts, a recent article published in this year's North Carolina Health News reported that community pharmacies turned away customers because they failed to have proper ID. They even justified the need for identification to the customer, stating it was the law requiring it, to ensure the person buying the syringes was actually over 18 years of age. Adding insult to injury, they went on to tell customers that the pharmacist could be fired, sued, or even lose their license if they didn't comply, all of which is just extremely and entirely false. To our patients, pharmacists are among the most highly accessible and trusted resources for healthcare information. We follow best practices based on scientific fact to medically manage and ensure the safety of our patients. Imposing restrictions on the sale of syringes based on misconceptions and further sharing erroneous information with our patients lessens the integrity of our profession. It also leads to a stigmatizing interaction that knowingly drive those who inject drugs to actually reuse or share needles. More importantly, it prevents those same patients from seeking our care in the future. What a missed opportunity that is. With evidence highlighting the public health risk associated with IV drug use, people who inject drugs are undoubtedly a population in greatest need of harm reduction services and a pharmacist's intervention. Some common misconceptions that influence a pharmacist's decision to restrict or refuse to sell syringes in general are precipitated by fear. For instance, pharmacists may fear they could be held liable for selling syringes to someone who injects drugs. They often think that selling will create safety issues or increase illicit drug use on their store premises. Some even feel it may encourage drug use or negatively impact their existing customer base, driving their regulars away. As troubling as all this sounds, after decades of research, there's simply no evidence to support selling syringes leads to any of these issues. Truth be told, no pharmacist in the U.S. has ever been sued for selling syringes to someone who later used them to inject drugs. Furthermore, several national studies have found no increase in the littering of syringes seen on or near pharmacy premises after a pharmacy began selling syringes. A study funded by the National Institute on Drug Abuse also found no increase in drug use because of providing sterile needles. In fact, choosing not to sell was correlated with a much higher incidence of reuse and sharing of needles, leading to increases in disease transmission. Understanding the impact the opioid crisis in our state is everyone's responsibility. Choosing to introduce strategies that address the negative consequences of opiate misuse is our profession's ethical and moral obligation. Even though North Carolina law, the North Carolina Board of Pharmacy, and the American Association of Pharmacists endorse the unrestricted sale of syringes, ultimately the choice to sell or not to sell is still a pharmacist's decision to make. However, it's essential to understand that choosing not to sell is dated and considered outside the norm given the current opioid climate. If you choose not to sell syringes, at least be honest with your patients and at a minimum, help them connect to resources in your local area that can assist them, like a syringe service program. Syringe service programs, or SSPs, have been legal in North Carolina since July of 2016. They offer numerous harm reduction services and provide a safe and judgment-free zone for people to comfortably exchange their used needles for unused sterile supplies. And they provide a gateway to clients to connect to other harm reduction resources and treatment when they are ready to take that next step on their road to recovery. While the number of SSPs continue to grow in North Carolina, be aware that currently there are only 48 programs serving 59 out of the 100 counties in our state, so they are not everywhere. To find out if there's an SSP in your area, you can visit the North Carolina Department of Health and Human Services link we provided here, or you can simply Google syringe service programs in North Carolina. If you're a progressive, service-oriented practice, there is a growing popularity among community pharmacies partnering with SSPs in the delivery of harm reduction services. In this collaboration, the pharmacy acts as an extension of the SSP, and the pharmacy benefits the SSP by helping to expand the geographic area where clients can receive supplies and other harm reduction services. It also helps extend the SSP's hours of operation since pharmacies are typically open for longer hours. Since September of 2021, NCAP has worked with 2 pharmacy sites in Pender County and an SSP in New Hanover County in a collaborative effort to expand harm reduction services to Pender County residents, a known desert area when it comes to resources for those with opiate use disorder. Results of this collaboration, from the development to the implementation of services, have been compiled in a comprehensive harm reduction toolkit located on the North Carolina Association of Pharmacists website. If you want to learn more about the non-discriminatory sale of syringes or how you can partner with existing syringe service programs, I encourage you to check it out. It has everything you'll need if you want to consider these service opportunities in your practice. For access, simply visit www.ncpharmacist.org. With that said, I thank you for your time and professional commitment to helping combat the opiate crisis as we know it in our state. Thank you.